We've all seen The Swan, the makeover show where patients undergo cosmetic procedures. People are more interested than ever about fine-tuning but not changing their appearance. These more subtle procedures must be planned with extreme precision. In the past, we used two-dimensional X-rays and images to plan these complex procedures with mixed results. These X-rays and images were compared to ideal proportions, largely based on beauty contestants. Modern three-dimensional imaging can now look at a person's anatomy and appearance in 3 dimensions to allow for the three-dimensional diagnosis and surgical plan. A paradigm shift in this particular field has been developed by Anatomage software, which is called the Table. It is currently in use at Stanford University for the anatomy students. This life-size virtual dissection table allows for the visualization of the human anatomy in 3 dimensions. In our office, we now employ 3D imaging systems that use the same technology for various cosmetic procedures. For example, in the Asian population, it is very desirable for women to have a rounded facial appearance. In the past, the reduction of the angle of the jaw was done by an incision inside the mouth, but it could be very uneven due to the limited vision and the need to eyeball the amount of jawbone to be removed. With these new advances in 3D imaging, this same surgery can now be planned and executed with absolute accuracy. This particular patient wanted a jaw angle reduction, so here we can look at her jaw on a 3-dimensional X-ray, and using the Anatomage software, we can print out her jaw in 3 dimensions to 1/10 of a millimeter accuracy. We can also have the vital structures, like the nerves, printed in a different color so we can avoid them. Here I have the model in my hand showing the areas of removal and the surgical guide. I can mark the exact areas that will be cut, and I can build a surgical guide that will be used during the surgery to remove the perfect amount of reduction to the bone. This allows for a perfect result in terms of accuracy and evenness of the reduction of the bone.